I have been practicing psychiatry for almost 30 years, and I noticed that the acute mentally ill patient has limited resources. And when I was young and I started at this, we used to have a state hospital. Um, in Ohio, I think we had up to 6 state hospitals, maybe even more, that were capable of taking care of the chronically mentally ill. And I have been noticing how the system has changed, and they have closed state hospitals um, in every city, including our city. And I think we only have like 3 hospitals now in this whole state, which puts a tremendous burden in the care of the chronic mentally ill patient. Mental health hospitals was the model that was used in all the states. They have several mental health, large institutions. And if you actually can research this, you will see that many of the old mental state hospitals were beautiful facilities, large campuses with many acres to house patients who could not care for themselves. But these facilities were not warehouses, they were beautiful facilities. As a matter of fact, I visited one, a former one in Indianapolis, and I was struck to see that these facilities had everything that a community will have. The problem that I think has happened since the 1960s, there was a new redesign of how to provide mental health services. And the idea at the time was to bring those patients back to the community, integrate them back into the community and not have them away, which although that was a great idea, did not appear to be practical as we can see now. Also, the driving force at the time was the cost of maintaining these large institutions. And we're talking 600 beds in a state hospital for a state like Ohio and Indiana, and they used to cost a lot of money. So there was a lot of pressure, economic pressure, to try to perhaps shift the burden and bring those patients back to the community so the states would not have to take care of them. In 1975, there was a very famous movie called One Flew Over the Cuckoo's Nest with Jack Nicholson. It was a great Hollywood film. I saw that when I was a child. And if you see this film, it portrayed a state hospital that was punitive. And not necessarily a place that you would like to be. I will have to say that because of this film, or the Hollywood depiction of it, and other depictions of films of how the state hospital, that you see examples of people who are not caring or perhaps evil, and not necessarily providing care for the best interests of the patient. I have to disagree with that. I think most people who are into the mental health field are actually people who do believe that they need to provide care and support and nurturing for those patients. So now that I have been able to see from this perspective, as a psychiatrist, I can see why it makes a very good Hollywood script, and it will sell a lot of tickets and make a nice story to tell, but it's not actually the truth.
Could you talk a little bit about the consequences that closing these state hospitals had on the patients?
Absolutely, the consequences are very, very real. Since I've been in practice here in Ohio, and I have started in Columbus, Ohio, moved to Dayton, and I have been seeing how the state hospital have closed, both in the Dayton area, and the number of beds have completely reduced. There are patients who cannot take care of themselves, even with the best treatment, and these patients have been left to fend for themselves. The idea was to have community mental health centers have teams to follow them and to help them with housing and management of their daily activities. That has been unsuccessful. As a result of that, these patients, because of their severity of their illness, they will end up homeless because they cannot manage their apartments or their homes. They're victims of being abused, victims of substance abuse, of neglect, of being taken advantage of. Um, um, Also, these patients who are elderly or maybe medically compromised end up in nursing homes. We have a large population of mentally ill patients now in nursing homes, and also they will end up in prison because they will not be able to protect themselves from maybe the elements, and they will be charged with crimes or be sentenced for trespassing or other things or behaviors, and they end up in prison, and then they're not getting adequate mental health services there. So you see, from a structure caring environment of the state hospital system, these patients are now in systems who are priority not designed to provide care for the mentally ill patient. Nursing homes are not prepared nor designed nor trained to provide this care. Prisons definitely are not. Just because they have a provider, a nurse, or they give them medicine, is not the care that they need. It's not the environment that they need. Being homeless, well, they might be able to be monitored by some team that follows them if they can find them. I see them in the hospital over and over and over again because they don't have any support. So in my view, the lack of a centralized state hospital system that adequately could provide for the needs of the people in the state has been a failure, at least from my perspective.
Do you have personal experience with people who have been homeless or?
Every day, I'm an attending physician at a local hospital here in Dayton, and 50% of my admissions are homeless, and they all are supposed to follow with the community mental health system. And to my dismay, they either have not been seen by a team or the doctor or psychiatrist, or they have not been on medication. It's a revolving door. That's actually what I see. I stabilize them in the hospital and return them to the community. That means to the homeless shelter, with an appointment to see their doctor maybe a month or so at the community mental health center. I mean, do you actually expect them to follow up? I see them back in the hospital because they didn't get the medicine. They ran out of whatever I prescribed. So the community system is very stressed. And I don't want to blame the community system. I just don't have enough doctors, enough case workers. Now, this is perhaps the experience here in this county because we live in a major metropolitan city. Perhaps it's not the experience if you live in a rural county in Ohio. But if you go to every city, Cleveland, Cincinnati, Columbus, Dayton, it's the same story. Resources are stretched to the max, and we don't have enough. Unless if the patient commits a crime, becomes a forensic case, and then a judge will order this patient to be, because they cannot be deemed competent to stand trial, then they are okay to go to the state hospital for care for the next 6 months. That is a travesty, that only the people who get adequate care are the mentally ill patient who trespass or committed some domestic violence or has some legal issue. If somebody who is just mentally ill and doesn't have a legal case, you're out there to fend for yourself.
You mentioned resources earlier. Is that the community-based model doesn't have enough money or doctors? If it were a question of resources, if that model was given enough resources, then state mental hospitals wouldn't be necessary?
Well, that was the idea when I came into the psychiatry back in 1992. And I thought that perhaps if enough resources were given, then we could make. I am still waiting for those resources. You see, it's not a priority to allocate money for those services. In Ohio, now we see like a resurgence of perhaps of interest because we have a major crisis with opiate abuse and substance abuse. And therefore there's a lot of interest because a lot of people have been dying from overdoses. But substance abuse issues are, although important, not what we're talking about here. We're talking about people who did not make the choice to be mentally ill. We talk about people who, unfortunately, they were struck with schizophrenia or bipolar disorder, so severe that they cannot hold a job and cannot manage their daily activities. These patients could be better served in a very loving, caring, nurturing program in a state hospital that provides moral care. This is not a new concept. This is something that has been discussed and has been done in other places. Moral care is based on dignity. You see, we sometimes don't realize that the patients who are severely mentally ill, we try to just treat them like they don't know, or they don't have any feelings, or they don't have any importance of what they think. Moral care provides dignity back to the patient, in which we try to incorporate the patient's needs and interests in part of the treatment plan. Moral care also tries to provide some baseline or some guidelines of how we should respond to these patients, and not necessarily make the mistakes that we perhaps as a society did in the early 1900s or late 1800s, in which we used to have facilities that were just warehouses and did not take into account that the patients had some values that we needed to support. It was the mentality of the time that we knew better, we knew best. Therefore, what they thought was irrelevant. I'm gonna provide you an example. In school, everybody goes to school, right? You have to feed the students, right? Well, the old model, I grew up with this, is a cafeteria. You just go in line and they serve you whatever they fix on that day. If you don't like it, you don't eat. They don't care. It's just the food of the day in a line, not necessarily very appealing, but that's it. It's just a cafeteria. Moral care is not the cafeteria. Moral care is providing options and ideas and trying to provide through the experience of, if you're gonna go eat, might as well have an experience that is positive and nurturing. So you have options that you feel good about. So that's what, for me, moral care is. We need to go away from the cafeteria model and move into the model of, I'm trying to provide a very nurturing, satisfying experience for something that is humanly basic, which is to eat. So we can have cafeterias and we'll eat canned food, or we could have an experience that is positive and nurturing and beneficial for your whole being. That's moral care. You can do that in mental health. If I were to practice psychiatry in a rural county where there's no hospital, soon as the patient is chronically mentally ill, I will have much better chance to send this patient to the state hospital for adequate care than if I were in a big city. The beds are limited, and the burden falls into the hospitals, and those hospitals are not designed to provide long-term care. We're talking somebody who needs to be in the hospital for 3 months. The local hospitals, none of them here are designed or set up, or their programs are designed to be able to maintain a patient who needs a lot of care for 3 months. It just feels more like imprisonment. It's very secluded, it's very limited. Because of the managed care and the way things have changed in the care of mentally ill patients, we have turned the local hospitals into crisis stabilization units. Basically, the average length of stay of a patient is 3 to 5 days. That's for somebody who's perhaps depressed, suicidal, or having maybe bipolar disorder with a manic episode. We can stabilize them in a short period of time and then move the treatment for outpatient. But a patient who's chronic mentally ill, who's severe mental illness, there's no way that we can provide what they need in 3 to 5 days. So the hospitals themselves are not designed to keep somebody there for 3 months. I think that it's a disconnect there. The state hospitals were able to. They had parks. Back in the past, they had gardens, patios. You don't find any of that in the local hospital. You just find your bed and the lounge, and that's it. If you show to the hospital and you unfortunately have a cardiac event and suffer a stroke, you will probably find several facilities that will be more than willing to provide you rehab care for 6 weeks, 8 weeks, with physical therapy, maybe speech therapy, all kinds of treatment to help you recover from the stroke. Up to 2 months, 3 months if you need to. People with acute COPD or breathing problems that cannot be weaned off their ventilators can be transferred out of the hospital to other long-term hospitals in which they slowly can be weaned off from the ventilator up to a month, 2 months. There are several facilities out there. And the concept here is that they are supported by insurance. You mean? It's less costly to provide that type of care in a rehab facility than in an acute hospital. Therefore, after the patient's stable, they were able to transfer to this other facility until they're able to breathe. They wean off the ventilator, you know? Or if you suffer a stroke, or even if you break your hip, the surgery is done, everything is taken care of. You can go to this rehab hospital for 8 weeks and no questions asked. We do not have that in psychiatry. We do not. If I have a patient who's depressed and suicidal more than 5 days in the hospital, I get a phone call from the insurance plan asking me, what's wrong with this picture? What am I doing wrong? What's my plan of care?
So the insurance companies don't take mental health seriously enough to cover it.
If I discharge within their perceived allocated number of days, I'm okay. I'm within their standard. But if the patient requires longer, I have to fight for the best interest of the patient. It's sad. It's sad that I have to convince somebody that the patient needs more care than, if I don't want the patient to be in the hospital, and I certainly I believe that the patient don't want to be in the hospital either. But if I keep the patient in the hospital, you better know that it's because I think it's the best option for the patient, and it's less risk. Despite everything that I just said, I'm very optimistic. I got into this field because I believe in what I do. I believe in what's best. The most everybody wants the best for everyone, and I care, and other people care. I'm not alone, and I will continue to fight for the rights and benefits of the chronically mentally ill and the people who don't have a voice, because they need us. And because of that, I will continue to do this until it's time for me to quit.